Hi, I'm Dr. Sarah Bennis, she, her pronouns, and I am an assistant professor at Southern Connecticut State University, and I'm your 2023-2024 Shape America president. I am very excited to be here to help kick off Health Literacy Month, which starts in October, with a brief state of health education report, more maybe like a reflection, and then to share some of the materials and learning opportunities that will be offered by Shape America during the month of October in order to really help you celebrate Health Literacy Month and elevate it in your classroom and school. So to start, I was thinking about, what of the many things did I want to share about a state of health education in 2023? And really the theme that stood out to me is opportunity, and really thinking about opportunity in terms of how much health education we are offering, and then also what that health education looks like. So in terms of the first one, how much, looking at the 2020 school health profiles data, which is available through the Centers for Disease Control and Prevention, we see that the most health education is offered in grade 9 across the country, with about 74% of secondary schools offering at least one required health education course in ninth grade. But then we see from there, kind of both below and above, it really drops off. So in grade 10, the number is, I'm just having to double check, I can't see, 49.8%, want to get my data correct. And then it goes down from there after in 11th and 12th grade, with only 27% of schools nationwide offering a required health education course in 12th grade. And then we see similar numbers in middle school, where grade 6, it's 47.4% offer a required course, 7th grade, 59%, and grade 8 is 52.7%. So we see that there's lots of opportunity for increases in the amount of required health education, really in 6 through 12. Because even with the 74.1% of schools in offering required health education in ninth grade, there's still about 25% that isn't, right? So there's lots of growth in that particular respect. We also don't have data about what's happening at the elementary level, so like the pre-K to 5 level. And anecdotally, at least for me and my experience, there's often not health education at that level, or if it is, it might be happening in 5th grade, and it's often related to puberty, and it's not necessarily a comprehensive, whole programs K to 5. Or it might be offered as part of PE, but again, it's sort of not its own separate course that is, has a progression over multiple grade levels. So lots of opportunity in terms of how much health education is being offered, though again, it's always, good to also see what is being done. So even as we're thinking about opportunities for growth, also stopping and recognizing, the positive things that are happening in our spaces already. And then the second area of opportunity is really thinking about, how we're teaching health education. So interestingly, I actually just asked some of my students who are in my Foundations of School Health class. There's about 20 students, their experiences in their K-12 health education classes, if they had it, and certainly like if they remember it. And unfortunately, now these are all students who are, they're grad students, but they're often sort of right out of undergrad. So maybe like early to mid 20s. So they haven't been that long out of their K-12 experience. Many of them still talked about having health education that was boring, that they didn't really remember. One student talked about not feeling like their student voice was heard in class. A lot of them talked about the kind of typical things that or some of us at least maybe think about when we think about our experience in health education, which is, they had STI talks, they had, drug education, nutrition education, and really that was sort of it. So again, these are students who are not that long out of their health education experience, who are reporting the things that we really want to try to move away from, right? So Andy Milne had a great TED Talk that if you haven't seen it, definitely encourage you to check that out. I want to get the name right. This is not your parents' health class. Really helping to sort of myth bust, if you will, about, what health education is, because unfortunately, many people are still having health education experiences where they didn't feel like it was meaningful. It didn't feel relevant. They didn't feel like their voices were heard, and it was pretty sort of limited in its scope. And so if that's what our experience was, and then we go and we meet someone who's like, oh yeah, I teach health, or, I'm advocating for health education, and people are thinking back to that kind of health class, it's sort of like, well, what, is that, how does that sort of help move us forward? So definitely thinking about, how we are ensuring that we're implementing health education that is current, up to date, relevant, that it's affirming of all student identities, that it's teaching skills, it is trauma responsive, it is culturally responsive and sustaining. There's just so much, again, opportunity for us to do health education in a way that is really supportive of our students and that connects to who they are right now and the challenges that they're facing related to their health and well-being, and the challenges that are being faced in their community, as well as, again, building on all those strengths and resources that exist to support young people. So that's kind of the theme that I'm going to encourage you all to think about this year, is really opportunity. So how do we advocate for more health education, and how do we support ourselves and each other in really advancing our practice? I mean, I'm constantly learning new things and new ways to be teaching health education, new ways to be thoughtful about equity and justice and social justice approaches. It's constantly learning. So taking this opportunity to reflect on our practice, and to really think about, how do we and what can we do in our spheres of influence to move things forward. There's definitely been a lot of growth for sure, which is so exciting. And one of the reasons why I was really compelled to get involved in Shape America, starting out on the Health Education Council and now coming up to being president, was because of the good stuff that's happening. And, now we see more textbooks coming out. We see more articles coming out. There's so many more resources related to supporting health education than there was, when I was starting this work, I don't know, 13, 15 years ago. I got to do the math one of those days. So there's lots of good stuff happening, right? Hopefully you already know that we have new national standards coming out in March of 2024, which I'm so excited about. So kind of, big celebration in Cleveland for that. So there's just, again, opportunity for us to use this momentum. I think also, COVID-19 provided, you know, a different way for folks to understand the importance of health and well-being as it relates to school and learning. And I think as health educators, we can leverage that opportunity to really kind of reaffirm our importance in schools, and to really advocate for, why effective health education is a critical part of students' educational experience. So opportunity, opportunity, opportunity. And I'm really excited to hear about the things that you all do, not just during Health Literacy Month, but at any point. Would love to hear from you on Twitter at Sarah Bennis12. You can feel free to email me, BennisS1 at southernct.edu. Love to, hear what you're doing to think about embracing the opportunity that we have, again, not just during Health Literacy Month, but certainly it's a great opportunity to help make those connections to health literacy, right? We know that all the skills that we teach in health education are also supporting the development of health literacy. So there's so much stuff that we can do, again, not just this month, but always. And so that kind of summarizes my state of health education. I would love, again, to know sort of your perspectives on the state of health education. And I'm really excited to work together with everybody, with the new standards coming out and all the new supports and resources that will be coming, to really continue to advance practice and move health education forward together, because that's what it's all about: being in community, doing the work that we do, supporting each other, and advocating for the subjects that we know are just so critical to student well-being and overall success, not just in school, but in their lives outside the classroom as well. So I also want to make sure that I share some of the upcoming materials and learning opportunities that will be available again for the month of October. So there's a blog post that will be available that actually helps you plan your own health literacy month. So very exciting. And again, would love to see you posting on Twitter and making sure that you're tagging Shape America, and me too if you want. But at least Shape America, let us know what you're doing to celebrate Health Literacy Month. And then also there will be some online learning opportunities, both live and recorded throughout the whole month. And I want to read the list of things. So I'm going to move over here. So we're going to have a session on skills-based health education, which I will be facilitating the first week in October. There's also going to be learning opportunities related to social and emotional learning, sexual health education, drug abuse prevention, and more. So hope to see you at some of those live sessions, and hopefully you'll be able to access some of those recorded sessions. There, you can also join the discussion on Slow Chat. So there's just lots of ways to connect and get involved and use these materials to help support your practice, to help advance your practice, and to help celebrate and uplift health education during Health Literacy Month. So again, hope to see many of you at some of these different online learning opportunities. And I'm excited to see all the awesome posts about what you all are doing to celebrate Health Literacy Month this coming October. Thanks so much.